The CEO of Moderna says the company hopes to have a combined COVID and flu vaccine ready sometime next year. But Dr. Fauci is warning the time frame for the virus to become more manageable is still a ways off. Speaking during a virtual panel, Moderna's chief executive said the goal is to require just a single annual booster for people instead of multiple shots. But Dr. Fauci, who was also on the panel, says it's too soon to tell whether Omicron will shift the COVID pandemic towards something more like the seasonal flu. There's a lot of misinformation. A lot of people are looking everywhere, trying to find answers, talking to their personal doctor. We want to go to an article's headline that actually is going to maybe give us a little bit of clarity. This piece is actually known as or referred to as a pre-printed study, a study that has not been peer-reviewed or published by a respected industry journal. So how do we make sense of this? What is to be trusted in a document like this? We want to have Dr. Kristin Englund join us right now to kind of break this down. She's an infectious disease specialist at the Cleveland Clinic, has been here many times. Thank you so much for coming on again. Let's go deeper between this term pre-printed study versus peer-reviewed study. What's the difference?
Good morning, Adrienne. Thank you so much for having me here. And this is such an important difference here. So when we submit an article to a journal, an editor looks at that and then asks other peers to take a look at the article as well and review it. And these are peers who have no ties to the person who wrote the article, who are experts in the field, and go through very carefully and review the article and make recommendations whether it should be printed, whether it needs to be revised, or whether it's perfectly acceptable. And the amount of times that it's initially accepted right off the bat as perfectly acceptable to be put in the journal is pretty few. Usually there are revisions or explanations that need to be made.
Do studies with small samplings and no peer reviews carry any significant weight?
So oftentimes what we're trying to do now is get information out quickly. And that's why journals or articles are coming out now in preprint and not peer reviewed. So you're trying to get information about a virus that is moving very quickly out. But that does mean that you have to read it kind of with a grain of salt. You have to be able to take a look at it and say, well, the number is small, so that does not apply to a worldwide situation. Or look at the data and say, yeah, this has not been looked at by other experts. So we may need to look for a better explanation or a deeper explanation.
Well, let's go to the headline itself. The headline of this pre-printed study is saying that vaccinated people are more susceptible to Omicron. We've also been seeing a study out of Israel suggesting that that is truly the case, that the vaccine as it stands right now is not sufficiently effective at preventing the transmission of the Omicron variant. Is that true?
No, it's not true. And what you're looking at there from the Rogue Review is their evaluation of a study that is a preprint. So it's kind of like the game of telephone, where you have information that then gets evaluated by somebody else and spread. And so it's somebody's opinion of an article that's not been peer reviewed. So it's very difficult to make any kind of an estimate based upon that. The study that came out of Copenhagen, so the original study that is the preprint, was done at a time also around November 27th when Omicron was first coming on the scene, and there were a lot of what we call super spreader events that were going on around the holidays, and it was pretty well documented that there were large school parties where Omicron was moving very rapidly through it. So right at the very end of that study period, Omicron came into play. There were a lot of parties, and that really skewed the data. Even the article's writers stated that very clearly in their discussion, and their own conclusion is that this proves that we need to be getting boosters as well to help us to protect against the spread of Omicron.
Well, that in and of itself would suggest that this vaccine is not sufficient in itself, that boosters have become the latest signal that we're going to need a different kind of medicine to be fully successful. The WHO, the World Health Organization, said this. This is a quote: "If mandatory vaccination is considered necessary to interrupt transmission chains and prevent harm to others, there should be sufficient evidence the vaccine is efficacious in preventing serious infection and or transmission. But we've seen so many breakthrough cases of Omicron in vaccinated people. So is this quote from the WHO, is it suggesting that it's possible that vaccine mandates are not effective in preventing transmission of Omicron?
I think what the World Health Organization is stating is that, as always, we need more and more data. This Omicron variant has only been around since the end of November that it was first identified. So we do need to be getting more information about it. But I think what we're seeing in the hospitals is the fact that if you are vaccinated, you are not likely to end up in my hospital. You're not going to be in the intensive care unit unless you have other health issues. For the most part, if you've been vaccinated, and especially if you've been boosted, if you test positive, you're more likely to be asymptomatic or have very mild symptoms. So clinically, we are clearly seeing the effectiveness of vaccination and boosting. That, as always, to be able to make clear statements, it helps to see the numbers.
Yes, Dr. Kristin Englund, thank you for breaking some of those numbers down. Thank you so much for watching. Make sure to click on the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.